to create some information and policy around preconception health for people with disabilities. And it started with a collaboration between WOWDEC, which is a local women with disabilities health group, and the National Youth Leadership Network. And they sort of brought Oregon Public Health in as like an administrator for the ALC. And then they later brought my organization, which is Gimp Girl, in for further working with women with disabilities. Basically, we started by looking at what data existed for this population. We looked at the self-report surveys from junior high and high school students, and started to look at what data actually exists for this population. Basically, what we found was that these surveys aren't really made fully accessible to kids with disabilities. If you're blind or need help filling out a survey form or some other complication, there's no help for that. It's just not done. But even with the data that we had, we are finding that youth with disabilities are having sex more often, are using substances more often. They're having more unprotected sex. They generally do not have access to sex ed. So there's a lot of really concerning data for this population. And it's sort of a subject that isn't really talked about. It's kind of a verboten subject for a lot of people. And we're trying to, at this point, get our survey and information through our local state IRB. And they're sort of, not wanting us to work with adolescents because it's a vulnerable population. Like Sharon was saying earlier, it's a vulnerable population, so let's just not do anything about it. So we're having to refocus to 18 and older. We're sort of at that point where we're just getting through that process and starting to work on surveys and focus groups and whatnot. And we're hoping to create some policy around this issue.